Hey everybody, welcome to the CyberMD lecture on Starling Curves for the USMLE Step 1 exam. Starling Curves are a key concept in the study of cardiovascular physiology and are important to understand as they relate to the function of the heart and the circulation of blood. Starling Curves, also known as Starling's law of the heart, describes the relationship between the end diastolic volume of the left ventricle and the corresponding stroke volume of the heart. This relationship is represented by a curve that shows how the end diastolic volume and the stroke volume change as the heart's ability to contract changes. The curve changes as physiologic states that alter contractility come into existence. Factors such as hypertension, diabetes, and heart disease can also affect the slope of the curve by altering the compliance of the ventricular walls or the diastolic function of the ventricles. In the clinical setting, Starling's principle is useful to understand the cardiac output, cardiac function, and to recognize the causes of heart failure. It also helps to identify the response of the heart to various drugs and other interventions. The Frank-Starling relationship essentially states that with increased stretch, the muscle fiber can increase the force produced. This is known as increased contractility and is due to the optimization of muscle fiber length. The muscle fibers have specific sites called cross bridges where the myosin and actin molecules interact to produce force. When the muscle fibers are stretched, more cross bridges are formed between myosin and actin, resulting in increased contractility and increased force production. However, it is important to note that at some point, stretch becomes detrimental to the force of production. This is known as eccentric cardiac hypertrophy, which happens in systolic heart failure. In this condition, the ventricular chamber is dilated, but the muscle fibers are unable to contract forcefully. This means that the myocardium is stretched, but the muscle fibers are not able to generate the necessary force to pump blood effectively. This results in a decrease in stroke volume and cardiac output. In summary, Starling curves are a useful tool for understanding the relationship between the end diastolic volume of the left ventricle and the corresponding stroke volume. Understanding this relationship is important for understanding the function of the heart and the circulation of blood. It is also important to be able to recognize how different factors such as hypertension, diabetes, and heart disease can affect this relationship.